First up, let's talk about diabetic ketoacidosis, or DKA. This is an emergency that mainly affects type 1 diabetics, though it can also happen in type 2. The cause of DKA is absolute insulin deficiency. The main issue, high blood sugar plus ketone production equals metabolic acidosis. What triggers DKA? Infection, illness, missed insulin dose, and stress. Without enough insulin, the body starts breaking down fat for energy. This produces ketones, which build up in the blood, making it acidic. Some signs and symptoms of DKA include polyuria, which is excessive urination, polydipsia, which is excessive thirst, and fruity smelling breath from the ketones. Kussmaul respirations, which is deep labored breathing, is also present in DKA. Patients may also have abdominal pain, nausea, and vomiting. Confusion and lethargy may also be present. If left untreated, DKA can lead to coma or even death. So let's talk about how we manage it. First, we will administer IV fluids to correct dehydration. Then we will administer IV insulin to lower the blood sugar. Then we're going to administer electrolyte replacement, but watch for potassium shifts because that could cause dysrhythmias, and that's a whole nother problem. We're also going to monitor the blood glucose and ABGs. Now, let's talk about HHNS. This primarily affects type 2 diabetics and is also a life-threatening emergency. Causes of HHNS include insulin resistance or severe illness. The main issue of this is extreme high blood sugar, but no ketones present in the urine. Triggers that trigger HHNS is infection, dehydration, and undiagnosed diabetes. Unlike DKA, HHNS does not involve ketones or acidosis. Instead, the blood becomes super concentrated with glucose, leading to extreme dehydration and neurological symptoms. Signs and symptoms of HHNS include severe hyperglycemia, which is a blood sugar above 600, profound dehydration, altered mental status like confusion, seizures, and even a coma, weakness and lethargy, and dry mucous membranes. This condition can sneak up on patients because symptoms develop slowly over days to weeks. Now, let's look at treatment. We're going to administer aggressive IV fluid replacement. That's our number one priority. We're also going to administer IV insulin cautiously, electrolyte management, and frequent neurochecks. Okay, let's do a quick recap and compare these two conditions. In DKA, this normally happens in type 1 diabetics. In HHNS, this happens in type 2 diabetics. In DKA, the blood sugar will be above 250, and in HHNS, the blood sugar will be above 600. In DKA, ketones will be present. In HHNS, ketones will be mild or absent. In DKA, the pH will be acidic, so it will be below 7.35. In HHNS, the pH will be normal, so it'll be above 7.35. In DKA, the onset is very rapid. It can happen within hours. In HHNS, this could be a gradual onset and last days. For both of these conditions, we're going to provide them fluids, insulin, and electrolytes. Remember, both conditions are medical emergencies, but DKA is about acidosis and ketones, while HHNS is about extreme hyperglycemia and dehydration. And that's a wrap. I hope this breakdown of DKA and HHNS makes it easier to understand. If you like this video, like, and share with your classmates. And see you in the next video.